Well, government is currently planning to roll out around 40 million doses of COVID-19 vaccine by the end of the year. The first 1.5 million doses will go to healthcare workers, but there are questions around how you make sure that there is an equitable distribution of the vaccine. Fatima Hassan is the founder and head of the Health Justice Initiative. Fatima, good afternoon to you. How would you describe the rollout plan as it is currently? Do you think it'll work and make sure that people who need a vaccine actually get it?
So thanks, Stephen. I think the first thing we should point out is that we actually don't know the full plans. What we do have is the broad parameters of the aspirations of government in terms of how it's going to prioritize groups. But they have set up various task teams and various committees, which obviously we've argued don't have sufficient representation of all stakeholders. But be that as it may, these committees are now tasked with developing more detailed plans and proposals. And so there's a few short documents that are included in the MAC advisories, which are now available publicly. And aside from the briefing that was held last Sunday and the presentation to Parliament, we yet to receive, more detailed or get a more detailed sense of what the rollout will actually look like.
Some of the questions are pretty obvious. I mean, I think it's obvious to everyone that healthcare workers should get vaccinated. First, they're most at risk and we rarely need them. The argument sort of, I think, starts after that. So if I were the leader of a teachers' union, I would say, well, teachers must be next. We need to make sure that they can be in class and that they're protected against the virus. If I were a policing union, I'd say, hold on, we should be next in line. How do we decide who gets vaccinated after healthcare workers? Do we start with the politicians?
Well, it's an interesting debate that people are having. You may need to start with a few politicians and celebrities to show that the vaccine is safe and effective, so that people actually buy into this idea that the vaccine is something that can actually take you out of this pandemic. But that's a separate issue. It's certainly what other countries and governments have done. But if we return to the issue of how do you define priority groups, there's some indication in some of the documents that have been shared. And like I said, it's not sufficient. So there's broad indications of healthcare workers and frontline workers will be prioritized, but certainly there needs to be more engagement with different worker formations, including, formally organized and informally organized labor groupings, to actually work out and disaggregate what that actually means. So there's, meant to be 3 different phase out, rollouts in 3 different phases. And there's different priority groups identified in each of those, but they're I would say they're very general and they're very broad. And we certainly do have some concerns around more vulnerable groups and people who live in, poorer communities, in informal settlements, in densely populated neighborhoods. There's issues around asylum seekers, refugees, migrants, sex workers. So there's a lot of, considerations that still have to be, thought through and a lot of information that still has to be shared.
It does seem the private sector is playing a role here. I mean, it seems that medical aids, for example, are being involved in this, and maybe even some of the funds that they actually have, that they've been able to save up some of their savings, will actually be used for people who don't have medical aid. I mean, would you support that? It does give the private sector a little bit of power in the process. I don't know how you feel about that.
So, I mean, it's something we've been calling for. We said one country, one plan. You can't have 2 parallel vaccination, acquisition and rollout programs because, underpinning the vaccination rollout for the whole country has to be equity. So I think what is quite significant, and I do believe that it's a game changer, and obviously there have to be, relevant levels of oversight, is that all of the medical schemes and the entire private health sector are actually on board with this idea of social solidarity. It's really disheartening to see that there are groups who are trying to actually stop that. And that's something that as civil society, we will have to intervene in and make sure that, we don't have 2 different plans for our country, because that would result in vaccine apartheid. What is going to happen so far from the limited information we have from the Council for Medical Schemes and the press statements of other medical schemes as well, is that in addition to it being a compulsory prescribed minimum benefit for all members of all schemes, including low-income workers that belong to, for example, GEMS or POLMED, so the police and healthcare workers and teachers, for example, including parliamentarians who belong to PARMED, is that there will be a cross-subsidization element. But the one issue that we also need to, remember is that by negotiating supplies for the entire country, there could potentially be price benefits for people in the private sector. Because as you know, at the moment, the situation is when you're procuring medicine, say, for example, for cancer, the private sector pays much more for the same medicine that you can access it in the public sector. So there could be some savings. And I think that in turn would allow medical schemes then to cross-subsidize those those people in our country who don't have medical insurance, and would make it then more affordable. Of course, the issue is where you're going to find supplies, what price are you going to pay, and how willing are you to take on pharmaceutical power to make sure that there can be an urgent global ramp up of production, so that as we've said before, everyone everywhere who needs it can get access to a vaccine.
You alluded, and I presume it was the court application that's been brought by Solidarity and AfriForum that you were alluding to, by people who are going to court to suggest government should not have a monopoly on vaccines. And the point that they make is that there's been, and I don't want to argue for them, but their argument, as I understand it, is that there is proof that that there's been corruption in the procurement of PPEs, for example, and we have seen that, and therefore that government can't, I suppose they're arguing that government can't be trusted with this. You disagree strongly with that argument from what you've said. You believe government should have, I suppose the right word is a monopoly on the procurement of vaccines for South Africans.
So, I mean, I would disagree in the sense that I don't think it's a monopoly. This is not how you define a monopoly. This is how you define state action in a pandemic when there is a national and global crisis, where scarcity has meant that there are limited global supplies. So basically, I really think that the only way the public and private sector can actually urgently access much needed vaccines so that we can create some level of herd immunity is actually through the process that has been set out by government with the support. It's an unequivocal support of the private health sector, medical schemes, and the business sector. So, ordinarily we would see medical schemes taking government to court almost immediately if there was opposition to that. So I definitely wouldn't define it as a monopoly. I also think that it's slightly short-sighted, because while corruption is a really legitimate concern, if you have the necessary oversight mechanisms where government in this case is including business and the private sector, that could potentially mitigate that. But for me, corruption is also a two-way show. It takes the private sector to enable corruption. I don't think that government alone undertakes corrupt practices, and we certainly saw that with state captures. A lot of the state capture was enabled by private sector players and private sector organizations and companies and advisors, including people in the financial sector space. So I think it's a bit disingenuous to say that if the private sector is in charge of procurement, there'll be no corruption, and that if government does it only by itself, that there will be. I certainly think that it means that faith organizations, civil society, and an independent media have to really monitor the rollout. Already we've been saying that there's no pricing transparency, and there's no pricing transparency on the part of pharmaceutical companies. It's our government that's trying to get the relevant information, and our government who's now in a desperate situation where they're taking any vaccine with varying effectiveness levels and paying the price that's being asked, because basically, we were caught napping. But also, we're dealing with a global situation where there's limited supplies for everybody. Just a few days ago, the WHO's Director General said that all rich countries that bought extra stock should actually give it back, and they should give it back to, the institutions that the WHO has set up. So I think there's definitely a reckoning moment for the world. We're facing a severe crisis. It's global vaccine apartheid, and I think that all role players had a role in actually creating the situation that we're in, which is really one of scarcity and now desperate need.
All of this brings up another issue, which I think gets even more complex, and I realize this is a complex issue already, which is that two private pharmaceutical chains, they're big name brands in South Africa, as I understand it, have said that when enough vaccines become available, they will actually allow someone or offer a vaccine. So you would literally go to your pharmacy, you would pay your money, and you would get a vaccine. Now, the arguments, a bit like private schools and government schools. On the one side, the argument might be, well, if there's scarcity, that shouldn't happen, and it would, you use the word vaccine apartheid. I would imagine that supporters of this would say, firstly, someone has a right to a vaccine if it is available, if the product is available and they can pay for it. The second argument might be that it would relieve some of the burden on government. How do you see that?
So I definitely think that from what we've seen in the documents that have been shared so far, and I can't stress enough that they're limited, there's certainly an effort that's going to be made to bring in all role players to help government administer the vaccine. So nobody's saying that the private sector or leading pharmaceutical chains, for example, are not going to be allowed to administer the vaccine. I think where the conflation and where the wrong conflation is happening is who tries to procure and acquire and get supplies into the country. And then the question is who actually stores the vaccine, particularly of some of the vaccines which need, specific cold storage facilities, who distributes the vaccine, and then who administers it. My sense is I don't think government is saying that they take total control over all the administration of the vaccine. They're talking about mobile clinics, they're talking about using shopping centers or using parking lots. So there definitely seems to be an attempt to bring in the business and private sector to use some of their facilities to do so. And I think the president also met with certain leading faith groups yesterday, and presumably one would be doing vaccination in churches, in mosques, in temples, in shuls, obviously in a socially distanced way and in a safe and effective way. So, to vaccinate 40 million people or more, because it depends on which vaccine you use and the different efficacy levels, you're going to need every single partner, every single school, every single library to be used in our country to be able to do that. Stephen, I think the last time this country actually did that, and I stand to be corrected, was when the country was closed down for 3 days to administer like widespread polio vaccinations. And that may have been like over 50 years ago. So yeah, a really, really difficult task ahead. And of course, we're all concerned about the potential for corruption. And of course, we're all concerned about the potential for price gouging and for people becoming, unnecessary middlemen so that they can profiteer off a pandemic. But that is why, we need a strong civil society and a strong independent media to ask the questions and to continue asking not just government, but also drug companies about their role in creating the scarcity.
Fatima Hassan, thank you. Founder and head of the Health Justice Initiative. Really do appreciate your contribution to a very, very important conversation.